Disclaimer. This video contains information on homeopathic remedy. The purpose of creating this video is to spread information and knowledge about this remedy. We strongly discourage any self-consumption of medicine without a qualified doctor's consultation.
Hello, and welcome to this video. Let's look at the homeopathic remedy, Calcaria Carbonica. About this remedy, we will discuss its common name, family and sphere of action, constitution and ailments from particular symptoms Part 1, mental symptoms Part 1, mental symptoms Part 2, particular symptoms Part 2, modalities, and its relations.
We have been receiving a feedback from our viewers that the videos are too long. Therefore, this video has been divided into two parts.
So, without wasting any more time, let's learn about this great remedy. Let's begin with its common name, family and sphere of action. The common name of Calcaria Carbonica is middle layer of oyster shell. It is also known as calcium carbonate. Calcaria Carb acts on bones, glands, blood, skin, mind and female genital organs. Moving forward, we shall discuss about its constitution and ailments from. Calcaria Carb is adapted to leukophlegmatic constitution. It is suited to fair, fatty, flabby person, who easily gets tired on walking with much sweating, cold extremities and sour smell of the body. Constitution of Calcaria baby. They are fair, fatty, flabby with red face. Have large belly like an inverted saucer. Large head, open fontanelles and sutures. Soft bones. Delayed milestones. Sweats easily on backside of head and neck. Have swollen glands. The temperament is of nervous type. They are chilly patients. Myasm, sora and psychosis are in background. There is a scrofulous, rachitic, and tubercular diathesis. The ailments are from defective assimilation, imperfect ossification, cold moist wind, self-abuse, fright, suppressed sweat, loss of vital fluids, mental strains, suppressed eruptions and menses.
We are about to start particulars Part 1, and then we will discuss Calcaria personality.
Regarding head, there are following symptoms. There is sense of weight on top of head. Icy coldness in and on the head, especially right side. Headache from overlifting, from mental exertion, with nausea. Vertigo from ascending, and when turning head. Much perspiration, wets the pillow. Now, let us discuss the eye symptoms. Eyes are sensitive to light. Lacrimation in open air and early in morning. Ulcers on cornea. Farsightedness. Chronic dilatation of pupils. Dimness of vision, as if looking through a mist. Moving forward to ear symptoms. There is throbbing, cracking in ears. Deafness from working in water. Scrofulous inflammation with mucopurulent otorrhea, and enlarged glands. In case of nasal symptoms, the nose is dry, nostrils sore, ulcerated. Stoppage of nose, also with fetid, yellow discharge. Offensive odor in nose. Polyp, swelling at root of nose. Takes cold at every change of weather. Coryza alternates with colic. Next we will look at the face symptoms. There is swelling of upper lip. Face is pale, with deep-seated eyes, surrounded by dark rings. Submaxillary glands are swollen. Goiter. In case of mouth symptoms, there are bleeding gums. Toothache aggravated by both heat and cold. There is dryness of tongue at night. There is difficult and delayed dentition. Offensive smell from mouth. Persistent sour taste.
We will shortly commence with the mentals of Calcaria, but let's first quickly complete some particular symptoms.
Let's look at throat symptoms. Swelling of tonsils and submaxillary glands, stitches on swallowing. Hawking up of mucus. Difficult swallowing. Moving to stomach symptoms. There is longing for cold drinks. Aversion to meat, boiled things, fat. Disagree milk. There is craving for undigestible things like chalk, coal, pencils, egg, salt, sweets. There is loss of appetite when overworked. Pit of the stomach is swollen like inverted saucer, and painful to pressure. There is pain in epigastrium. Aggravation by eating. Now comes abdomen. It is swollen and sensitive to slightest pressure. Liver region is painful when stooping. Inguinal and mesenteric glands are swollen and painful. Cannot bear tight clothing around waist. Gallstone colic. Increase of fat in abdomen. In case of stool symptoms, the patient is habitually constipated. Stool is large and hard, whitish, sour smelling. Prolapse ani, and burning, stinging hemorrhoids. Children's diarrhea during dentition. Sour, offensive diarrhea, with sour vomiting during dentition. Lastly comes urinary complaints. There is enuresis. Urine is dark, brown, sour, fetid, abundant, with white sediment, bloody. The bladder is irritable. Now, we will proceed to Mentals Part 1 of Calcaria Carb. Calcaria individual is slow, solid, down to earth, plodding. Calcaria is content to stay at home, and watch television, preferably with someone to cuddle, and a good supply of high-calorie nibbles. Security is Calcaria's principal concern. For Calcaria, security means familiar. Change is threatening to her. For example, she may stay in same job for 20 years, despite having the ability to take on something more demanding. Calcaria children are wary of new experiences. For example, they are slow to experiment with new foods, or slow to make new friends. Calcaria tends to be stubborn. She is usually very good at saying no. As Calcaria children get older, they are reluctant to consider different philosophies and point of view. Calcaria desires to be magnetized. She enjoys being charmed, particularly by member of opposite sex. Calcaria girls are prone to develop crushes, and will hang on heartthrobs every word. Calcaria individual is simple, homely, down to earth and pragmatic. They have natural, unpretentious quality, and a love of simple pleasures in life, such as eating, drinking, going for walk, watching TV. Calcaria is one of the sensuous types, deriving a great deal of pleasure from senses. Most Calcarias overindulge in food, since they find it so enjoyable, and being sedentary by nature they usually become overweight. Calcaria is often quite content in her obesity, since she is less conscious of her appearance, especially when she is secure in loyalty of her spouse. Calcaria's pragmatic, no-nonsense approach to life is put to good use at work. She is generally steady and reliable. Calcaria is certainly not workaholic. Although, she may at times work long hours, to help out her boss or colleague. But for herself, she would prefer to work shorter hours, and enjoy leisure. Calcaria treats strangers with some caution, but once he has demonstrated his good intentions, he is allowed into her family, to enjoy the homeliness, and comfort, and loyalty, that Calcaria extends to those she trusts. She has a generous heart, for anyone who is accepted into her wider family. Calcaria have love of home, and a nurturing tendency, which makes guests feel like part of family. Calcaria are good at looking after others, without falling into the trap of neglecting themselves. In a relationship, the Calcaria partner will generally be loyal, devoted, dependable and very supportive of the other, both verbally and practically. Calcaria are good at remembering the little things, which shows that they care, such as birthday presents, cup of tea, bunch of flowers, etc. Calcaria parent will be just as supportive and indulgent as the Calcaria partner, but in a relaxed way. Family life comes naturally to Calcaria, and children are generally nurtured without being smothered, and are allowed to fly the nest, without much fuss. Calcaria mother will most probably worry about her children after they have left home, but she will not stand in their way. Mildness. Calcaria is emotional, in sense of being soft, nurturing and sentimental. Because of Calcaria's earthiness, she is more stable and less dependent on others.
We hope you are enjoying this video. If you haven't yet subscribed to our channel, please do so now.
We will continue the mental symptoms of Calcaria in part 2 and further complete the drug picture.
If you have found value in this innovative presentation to Materia Medica, please don't forget to like, share and comment this video. Let us know which remedy would you like us to develop next.
Thanks for watching.